Hello, everyone. This is Nicole Ivory, your hostess. Welcome to this month's Coverage Over Coffee session. As you know, Coverage Over Coffee is an event hosted by AI Mutual that discusses various insurance products and topics in a fun and informative way that is very easy to understand. Today, we will discuss Medicare with Mrs. Margaret Ivory of Ivory Associates. With annual enrollment around the corner, this is one conversation you don't want to miss. So grab your hot coffee and delicious donuts. Let's get started. All right. Well, thank you so much, Mrs. Ivory. Welcome to the show.
Well, thank you.
Well, first of all, everybody's probably hearing that you have the exact same last name as me. So I have to tell everyone I'm really honored to have my mom on the show today. She's the queen mother. So everybody, thank you so much for coming. And so this is where I get all of my insurance knowledge from. She's been in this game for a very long time. So why don't you introduce yourself and let everybody know about yourself and Ivory and Associates and what you do.
Well, Medicare Made Easy is a conference call that I promote. I am a Medicare plans broker. I've been doing this since 1983 as far as insurance, but in Medicare for the past 17 years.
That's very impressive. That's awesome.
Yeah, so I like talking to people about Medicare. I like to explain things that are confusing in a simple format so that everyone will know what they have, why they have it, if they should change come annual enrollment period, what are the benefits, what are the benefits of having a certain plan. And that's my goal. Okay. So with the Medicare Made Easy conference call, I think Nicole will be giving you the information as far as the phone number to call and access code, so forth. But Medicare Made Easy is a conference call that explains Medicare in just 10 minutes.
That's awesome. Because people are very busy nowadays. I think that's, people need something like that. Yeah. Everybody's busy, with work and school and chores and just family and life. So that's awesome that you have a 10-minute course.
Well, normally, my clients who in the past who have come to me, it would take me about almost an hour to go through this. Okay. So we're gonna, we do the condensed format for the Medicare Made Easy, but it does explain Medicare to where people know what they should do annual enrollment period.
That's perfect. Okay. Well, this is great. So let's talk about this annual enrollment period coming up, and let's talk about the different or the various Medicare Advantage plans that's available.
Well, I'm a broker. Okay. So I represent.
And can you tell everybody what a broker is?
Okay, a broker is a person or an agent, insurance agent, who represents more than just one company. So in my case, I'm one of the a handful of brokers in McLennan County who represents every plan in McLennan County.
Very nice.
So I represent United Healthcare, Humana, and Scott and White.
Those are awesome companies.
Yeah, they are.
Yes.
And what I also do is evaluate what a person needs. I don't just say get in this plan or get in that plan, because that person may need something different from even their spouse.
Okay.
Or from their friend. So I do evaluate each person, find out, make certain that their doctors are in the network, make certain that their medicines are on the plan, make certain that their hospitals are on the plan. Okay. Plus other items.
That's great.
We have special plans. They're called special needs plans. So sometimes people have certain ailments or situations that allow them to join these plans. So, I actually talk with a person and then research what's best for them.
I love this because it sounds like you're very hands-on, very one-on-one. It sounds like it's just not about just putting people into something, but you really do care about your clients.
Well, what's interesting is that sometimes people don't need to do anything.
Okay.
If they have TRICARE or something similar to that, they may not need to do anything. Okay. But I will be upfront and tell them that, because you could put someone in something and it can jeopardize what they have. Okay. So, what we do is very specialized, and what we do should be very customized, and we should not just blanket I think that's the great thing about being a broker, because I can talk with the person, find out what they have, what they need, what their goals are, what, their particular situation, and then put them in that plan or in a plan that is best for them.
So let's just say I was meeting with you today, okay, and I need to know what's the best option for myself. Can you walk us through some of these plans that's available that people can choose from this year?
No, I really can't.
Okay.
I'm going to tell you why I can't.
Okay.
The plans for 2021, it's just now coming out. We can't talk about them until after October the 1st.
Okay.
So,
all right.
Because
so that means we
law,
have to have you back.
well, just by law. But even then, I want them to come out. I just don't talk about plans.
Okay.
That's not really I'm really not a company person.
Okay.
I'm really just client oriented.
Okay.
Because I need to find out about that person.
Sure.
And then find out from that situation, then we'll find out, what plan or plans or no plan that they need.
Okay.
So right now I really can't answer that because we don't have a real, there's not a real life situation, or there isn't a real client in front of me.
And is that for both the Medicare Advantage plans and the Medicare Supplement plans?
Yes, for both.
Okay.
For
All
both.
right.
There are two different things. A Medicare Advantage. Medicare has 4 parts to it: A, B, C, and D.
Okay.
Part A, you work for that. I mean, whether you're self-employed or whether you're employed by a corporation or a company, a part of your check or a part of what you pay when you do your taxes goes towards Medicare. It's kind of like FICA, FICA. And so you've been paying for that since you're probably 16, which I know how old you were when you started working. And I don't have lazy children, by the way. So they started working when they was like 15 and a half, 16. And so since you were that age, you have been putting away into what is called like the Medicare fund. Okay. And Social Security also. So Part A, you don't have to pay for when you turn 65, or if you're disabled and you get Medicare early, you don't have to pay for Part A.
Okay.
As long as you've had 10 years of employment or 40 quarters, which is, 3 months. Okay. You have to have 40 quarters or 10 years. And then you don't have to pay for Part A. But there are some people, sad to say, who got paid underneath the table.
Right.
Or they worked in another country.
Okay.
And they married someone here, and they're now either American citizens or permanent residents.
Okay.
Well, they have to pay for. Back up on permanent residents. Some of them did all their work history in America.
True.
So they also don't have to pay for it.
Okay.
But if a person is newly over here,
yes,
because I know some parents who have just come over here to be with their children, or they just got married.
if it's not documented, they can't count it.
If they're not documented?
No, not them. But I mean, if their work, if they're, their checks,
if they never paid into the system, they won't get anything out of the system unless they pay about $450. I think it's $452 for Part A.
Okay.
So you can pay for it.
Okay. That sounds good.
So it's $452 for that. Everyone has to pay for
Is that
Part
per
B.
month?
Per month.
Okay.
And everybody has to pay for Part B, which I think is like $143.
Okay.
And some odd cents. It changes every year.
Okay.
And everyone pays for Part B unless Medicaid pays for it on your behalf.
Okay.
Then the Part C plans can range anywhere from, and I didn't really talk about Part C yet, but there is A, B, C, and D.
Okay.
C is Medicare Advantage, and that can range anywhere from zero additional costs to whatever amount that the company wants to charge.
And what determines that?
The company and Medicare.
Okay. Okay, so it's on an individual basis.
That's on an individual company basis.
Okay.
And then, and just because you pay less does not mean you get less, or just because you pay more doesn't mean you get more. You have to look at each. Sometimes plans cost more and you get less.
Okay.
So that's what their evaluation comes in. And
yes.
so forth. But Part D is prescription drug plans.
All right.
So with Part D, sometimes it's coupled with Part C, the Medicare Advantage, and you can get C and D for zero. But then sometimes it's by itself, with certain plans, you could have it by itself, and that can range anywhere from $18 up to about $80.
So it is really good that you do meet with people one-on-one, because you have to look at their budgets as well, and what I guess will be taken care of for them, and how much that they are comfortable with paying out of pocket.
Well, and then most of my clients don't. Most of my clients do the Medicare Advantage.
Okay.
And a lot of them choose a zero plan or a near zero plan. They're very happy with it because a lot of these plans are inclusive.
Okay. That's good.
They're inclusive. So just because a plan is more doesn't mean you get more. I guess that's one main thing.
And you explain that to them, so they see that. So
because
they're like, okay, well, this plan is actually works best for me.
Well, I want the more expensive plan. Now, once I show them, I do an analysis of the 2 plans or 3 plans. They see that sometimes a zero plan or near zero plan is better for them.
Well, historically, when you do see those options, when someone does have, like, I'm just saying $0, $50, or $100, you automatically think that the $100 is going to include more benefits than a zero plan.
Right.
Because people may see that through their, internet carriers or something like that. So, of course, they would automatically do that. But I like how you have everything laid out for them to be able to clearly see that they're okay with having that $0 plan.
It's okay. And now this year, normally people come to see me. In the past, I used to go see people.
Right, because of COVID?
Because of COVID, we can't do either.
Oh, wow. Okay.
And I stopped going to people's homes who I didn't know, because I have been in some very precarious situations. I've been in gang members' homes, drug dealers' homes, KKK, Ku Klux Klan.
Because they need these services too.
And I sign them up. Unless they're real racist, then I wouldn't. But they need the services too.
Need the services
but I've been locked in homes. I've had a lot of things going on. I don't go to anyone's homes now at all.
Right.
But in the close distant past, I would only go to people's homes who I really knew,
which is good.
Who have been my clients since 2005.
Okay.
And so I'm just trying to say I don't. But this year, we won't be going to anyone's homes. We would be doing everything over the phone.
Okay, and I think that's a way to protect both yourself as well as the clients.
That's right.
Because this is the type of era that we're in right now. We don't know who's sick, who's healthy. And so I think, and also a lot of people are just not comfortable themselves.
No.
Coming to people that they don't know, and not everyone wear masks or gloves. So I think that's a wise decision, and I think it works out for both you and your clients.
Right.
So why don't you talk to me about what are the various times that Medicare recipients can enroll into the Medicare plan?
Well, when you're first new to Medicare, whether you are aging into Medicare at age 65 or you're disabled and under 65, you are in what we call the IEP or ICEP, and I won't go into the differences on that. But this is it stands for initial coverage enrollment periods. That's what basically stands for. And you have 3 months before your actual effective date, the month of your effective date, and 3 months after your effective date into Medicare. Part A and Part B.
An effective date is your birthday?
Not necessarily.
Okay.
I mean, it can be. In general, it is if you're aging into it.
Right. Okay.
And you're taking A and B at the same time.
Okay.
But your effective date, when you are disabled, is when Medicare and Social Security have determined that they're going to make that your effective date for your. You have to be disabled for 2 years before you can become eligible for Medicare, and they will tell you what your effective date is.
I got you. Okay.
Now, when you age into it, if you're taking A and B at the same time, there are some reasons why some people don't take B at the time. Your Part A and Part B effective dates are the same.
Okay.
But if you're working a job and when you're getting Part A anyway, you're working a job and you have group insurance,
yes,
you may postpone being in Part B.
Okay.
Because and even Part D, because you have that through your employer, through your company, and you don't have to spend that amount if you don't need to. And then whenever you do decide to either retire or the company decides that they're no longer paying for retirees Medicare plans, not Medicare plans, for their health plans when they're retirees, then you can get Part B at that time. And I mean,
That's
B as in boy, and then D as in David.
Okay.
And they tell you how long, there's rules about that.
I like that. There's some strategy there.
Yeah.
Yes, you don't have to overpay.
You don't have to overpay and double up on something you already have.
Exactly.
Some people do it just for safety, but you don't have to. Another group that I didn't discuss is veterans. We have some new plans. I'm not going to just go, I can't because it's not October 1st, but there are some plans that we have that are specifically, basically for veterans.
That's good.
And veterans, they could have, they still have to have A and B. And then we would, and they don't need D sometimes, but we'll sign them up for a Medicare supplement plan that doesn't involve D, because usually the veterans get their medicines through the VA.
Okay.
So that's why they don't necessarily need a prescription drug plan.
Okay.
But some still decide that they want that too. That's just up to them. And when we discuss it with them, we'll find out what's best for them, because they know how much they're paying at the VA for their medicines, and they may be able to get it less with us based on their situation.
I understand.
So, and then sometimes they have to pay more, and they'd say, well, you know what, I'll just stick with the VA, where I just pay X amount of dollars for all my medicines.
Okay.
So, but there's different options for different people.
Okay.
And we just have to evaluate it and talk with the person, evaluate it, see what their needs are.
All right.
See where they are. So I would encourage everyone. Oh, excuse me. Let me go back. I said IEP and ICP.
Yes, you did.
Then the AEP stands for Annual Enrollment Period.
Okay.
That's what's coming up October the 15th through December the 7th. It's a 7-week period. Everyone can change. That's when, like musical chairs, you can stay with what you have. I would say evaluate what you currently have, but you can stay with it or you can change.
Now, those days are October 15th through December 7th.
Right.
And you said those are 7 weeks,
so
correct?
It's only 7 weeks.
Only. Okay, you hear that, people? So this is the time for you to be able to make that decision.
Yeah, that's the time that everybody can move around.
Okay.
Everybody can move around.
All right.
Even the people that's in the IEP people, I tell them to still contact me because come January 1st, they need to see what's going to happen on January 1st. Because in the AEP, we're meeting from October 15th through December the 7th.
Yes.
But it takes effect on January 1st.
Oh, that's good to know. Okay, so everything is going to kick off on January 1st, 2021. So you're taking appointments now, correct? So
I will be.
On October 1st.
I will be taking appointments in a little bit. I don't have everything yet, but they can still call me and ask me to call them back.
Of course,
when I am in the position to.
I just want to make sure people know that they have this time, those 7 weeks, to be able to meet with you to get the information that they need, so they can make an informed decision.
But I would like for them to. I will be setting up the appointments prior to October the 14th.
Exactly, that's what I mean. Okay,
so mainly it's between. Everything is just so weird right now because of COVID.
Yes.
So basically, probably around now, I would be setting it up. October the 15th through September the 15th through October the 1st, so we'll be doing it. But I'm a little off. All of us are. So I would say that I'll probably be contacting. Everyone can call me, or I can call them, starting October the 1st.
That sounds fantastic.
Through October the 14th.
Okay, perfect. And I'm going to give that information out at the end, okay?
And then we have 2 more periods. SEP stands for Special Enrollment Period.
Okay.
That's for people who are newly on Medicaid. Well, they're in these 3 situations. That they're on Medicaid and Medicare, or they just got kicked out of Medicare and off of Medicaid, and they're still on Medicare, or they just got on limited income subsidy. There's many different reasons why you have a special enrollment period, or you moved. I'm just giving you a few, or you just got diagnosed with one of the diseases that we have. This plan is called SNP, but there's a special enrollment period. It's called special needs plans. There's a special enrollment period for that.
So it sounds like qualifying events.
Those
right?
are, yes, qualifying events, things that may happen to that, you may get on Medicaid or have gotten off of Medicaid, gotten on limited income subsidy, which is the extra help for your pharmacy, or you got kicked out off of that. Then the last one is OEP, which stands for Open Enrollment Period.
Okay.
And that's from January 1st through March 31st. I think I'm saying it right. That's only for people that's on Medicare Advantage, prescription drug plans, and they're able to make changes. If you are on other types of plans like Medicare Supplement or you cannot really move during that time.
Okay.
They can move. They can make a one-time change. Now, one thing I was going to say about the annual enrollment period, whatever is the last plan, you could choose multiple.
Okay.
I wouldn't suggest that. I would suggest coming to me and I'll tell you one time what you need.
Right.
But let's say that you already signed up with someone before you found out about me.
Yes.
And then you came to me and like, oh my goodness, I signed up with a guy last week, but based on what you're telling me, it's not the best. It may not be the best plan for me or the better plan for me. So the last one is that OEP. And so if you qualify for that you were in during an annual enrollment period, you were in a Medicare Advantage plan, then you can choose one time during the OEP, but several times through AEP. But the last one you choose in AEP is the one you're on. Okay. For a whole year, unless you change during OEP. Okay. And what I recommend that everyone should do now that we're coming up on that annual enrollment period, I would like for you all to check out my Medicare Made Easy conference call. It's a replay line. So you can call 602-580-9299. That's 602-580-9299. Put in this access code 1050813 1050813 and the reference number is 1. You may call this number 24 hours a day, 7 days a week. Once you do call that number and learn all about Medicare in just 10 minutes, then give me a call. I'm Margaret Ivory of Ivory Associates. You could call or text me at 254-523-8978. 254-523-8978. And you can even call now or text me now, and I'll just put you on the callback list, okay? And I look forward to meeting you. And I'm very happy that Nicole invited me to come and talk a little bit about Medicare. But I promise you, if you go on a conference call, it's all laid out, very smoothly laid out. But if you have any questions, give me a call.
And I love it because I actually went on the conference call myself to listen to it because I know nothing about Medicare, and it's very easy to understand. She breaks down the A, B, C, and D plans in great detail. She is definitely the person you want to contact if you have questions about which plan you need to select. So don't hesitate. Lock that number in, 254-523-8978, and definitely call that 602-580-9229. Do it on your way to work, or, if you're waiting to pick up your kids from school, or, just when you have some extra time, definitely do that, okay? And it'll be a great ride learning about Medicare. And we just appreciate her giving her time because I know this is a busy season right now. So I appreciate her fitting us in with our Coverage Over Coffee session. And we look forward to speaking to her in the future. Thanks so much. Thanks for coming out.
Well, thank you, Miss Ivory.
Thank you very much.
Thank you.